April 12, 1945. Crystal City, Texas. The dust kicked up in slow spirals as the truck rolled to a stop outside a weathered barn. Inside, a young Japanese woman named Midori pressed her face against the wooden slats, squinting through the gap. What she saw made her blood run cold, not from fear, but from disbelief. An American rancher, broad-shouldered and sunburned, stood in the doorway wearing a stethoscope around his neck like a ranch hand might wear a bandana. His boots were caked with red Texas clay. His hat sat crooked on his head, and pinned to his chest was a Red Cross armband that looked like it had been borrowed from a child's costume box. Midori turned to the woman beside her and whispered in Japanese, "They're going to kill us with incompetence before they ever get the chance to execute us. But before this story reaches its shattering conclusion, we need you to be part of preserving it. If you believe these untold chapters of history deserve to be remembered, hit that like button now and drop a comment telling us which corner of the world you're watching from, whether it's Tokyo or Tennessee, Berlin or Brazil. These voices were silenced once. Let's make sure they're never forgotten again. And if you haven't subscribed yet, do it now, because stories like this don't just educate, they transform how we see humanity itself." The laughter that followed was quiet but unmistakable. It rippled through the truck bed like a whispered joke in a classroom. The women, 23 of them, all former military nurses or support staff, had spent the last 6 months believing they were already dead. Captured in the Philippines, processed through interrogation camps, and shipped across the Pacific in the belly of a cargo vessel that reeked of oil and vomit, they had prepared themselves for execution, starvation, or worse. What they hadn't prepared for was this: a barn converted into a makeshift infirmary, staffed by men who looked like they'd wandered off a cattle drive and stumbled into a war by accident. To understand the depth of their contempt, you have to understand what these women had been taught. In Imperial Japan, Western medicine was viewed through a lens of suspicion and propaganda. Japanese military training emphasized spiritual fortitude over technological intervention. Pain was to be endured, not medicated. Suffering was proof of loyalty. And the Americans, those loud, materialistic barbarians from across the ocean, were portrayed as medically primitive despite their wealth. Japanese field hospitals operated with ruthless efficiency born from scarcity. Supplies were rationed to near extinction levels. Morphine was reserved for officers. Anesthesia was a luxury most soldiers never saw. Nurses like Midori learned to perform amputations with handsaws and sack, to stitch wounds with fishing line, to stop bleeding with pressure and prayer. They were trained to see medicine as an art of deprivation. How much could you achieve with how little? So when Midori stepped off that truck in Crystal City and saw the abundance, she didn't see progress. She saw waste. Shelves stocked with bandages still in their wrappers. Bottles of iodine lined up like soldiers on parade. Surgical instruments gleaming under electric lights. Electric lights in a barn. It was absurd. It was excessive. It was American. And to her it was proof that these people had no idea what real medicine looked like. They had resources, yes, but not wisdom. Wealth, but not discipline. She had been taught that Americans treated medicine like they treated everything else, with brute force and no finesse. The man with the stethoscope introduced himself through a translator. His name was Curtis Monroe, and he was a veterinarian from Amarillo who'd been drafted into the medical corps. He spoke slowly, earnestly, with the kind of Texas drawl that made every sentence sound like an apology. He told them they would receive medical examinations, proper meals, and clean bedding. He said it like it was normal, like it wasn't the most surreal thing Midori had heard in 2 years. She glanced at the other women. Some looked confused. Others looked angry. One woman, Yuri, crossed her arms and muttered loud enough for everyone to hear, "They'll probably check our teeth like horses." The room erupted in stifled giggles. Curtis didn't understand the words, but he understood the tone. His face flushed red, and he cleared his throat, fumbling with the clipboard in his hands. He wasn't offended. He was nervous. And that, more than anything, told Midori everything she thought she needed to know. These men weren't doctors. They were pretenders, and she and the others were at their mercy. The first examination took place that afternoon. Midori was called forward by a nurse, a tall woman with blonde hair pinned into a tight bun and eyes that didn't judge, only observed. She gestured toward a wooden chair near the examination table. Midori sat, spine rigid, arms crossed. Curtis approached with the blood pressure cuff, and she watched him fumble with the valve, his thick fingers struggling to twist the dial. She wanted to laugh. She wanted to cry. Instead, she just stared at the ceiling and wondered how long it would take for infection to set in. But then something strange happened. Curtis wrapped the cuff around her arm with surprising gentleness. His hands, large and calloused, moved with care. He didn't yank or pull. He didn't speak down to her. He just worked methodically, checking the gauge, making notes, then moving on to her pulse. When he pressed 2 fingers against her wrist, Midori flinched, not from pain, but from the unfamiliarity of touch that wasn't violent. He held her wrist for 30 seconds, counting silently, his lips moving slightly. Then he released her and wrote something on his clipboard. No mockery. No impatience, just work. Midori left the examination feeling more unsettled than when she'd entered. She had expected cruelty or incompetence. What she got was neither. She got routine. And routine, she was beginning to realize, was far more dangerous to her worldview than brutality ever could be. That night, the women gathered in the barracks, a long wooden building with rows of cots, and a single wood-burning stove at the center. The conversations were hushed, but the tone was sharp. "Did you see the way he held the stethoscope?" one woman said, like he didn't even know which end to use. Another added, "They have so much equipment, but no idea how to use it. It's like giving a child a scalpel." Yuri, ever the loudest, leaned back on her cot and said, "We should feel sorry for them. They're trying so hard." But Midori didn't join in. She lay on her cot, staring at the wooden beams above her, replaying the moment Curtis had checked her pulse. There had been no hesitation in his fingers. No doubt. Just quiet competence. She didn't say it out loud, but a question had begun to form in the back of her mind, one she wasn't ready to confront yet. What if they weren't pretending? The answer came 3 days later, when a woman named Sachiko collapsed during morning roll call. She crumpled to the ground without warning, her body folding in on itself like a marionette with severed strings. Her skin was pale, almost translucent. Her breathing came in shallow gasps. Blood seeped through the fabric of her uniform near her abdomen, an old wound, infected, festering. The other women screamed for help, their voices cracking with panic. and within 30 seconds the barn doors flew open. Curtis came running, followed by 2 medics and a Dr. Midori hadn't seen before, a man in his 50s with wire-rimmed glasses and hands that moved with surgical precision. They didn't shout. They didn't hesitate. They worked. Sachiko was lifted onto a stretcher and carried into the barn. Midori followed, her heart pounding, her hands trembling. She stood in the doorway and watched as the impossible unfolded before her eyes. The doctor barked orders in clipped, efficient English. Curtis and the others responded instantly, moving like parts of a machine. They'd cut away Sachiko's uniform with scissors that gleamed under the electric lights. They swabbed the wound with iodine. They inserted an 4-line. Midori had never seen an IV line outside of a Tokyo teaching hospital. They administered antibiotics. Real antibiotics, not herbal compresses, not prayer, medicine. The room smelled of disinfectant and urgency. The doctor worked with hands that never wavered, removing shrapnel fragments from Sachiko's abdomen with forceps so delicate they looked like they belonged in a jeweler's shop. Every movement was deliberate. Every tool was sterile. Every voice was calm. Midori's legs gave out. She sank to her knees just outside the door, her hands pressed flat against the dirt. This wasn't incompetence. This was mastery. These men, these cowboys, these ranchers, these Americans she had been taught to mock, were saving a life with a level of skill and coordination she had only seen once before in the surgical wing of Nagoya Imperial Hospital, where Japan's best doctors trained. Sachiko survived. By evening, her fever had broken. By the next morning, she was awake, weak but stable. The other women gathered around her cot, silent, shaken. No one made jokes, no one whispered insults. They just stared at the 4-bag hanging above Sachiko's head, at the clean bandages wrapped around her torso, at the chart clipped to the end of her bed, with neat handwriting documenting every vital sign, every medication, every hour of care. Yuri was the first to speak. Her voice was small, almost childlike. They knew what they were doing. Midori nodded slowly. Yes. Then everything we were told, ... Yuri trailed off, unable to finish the sentence. Midori finished it for her. Was a lie. The days that followed were marked by a quiet, creeping transformation. The women stopped laughing. They started watching. They noticed how Curtis sterilized his instruments between every patient. They noticed how the nurses changed gloves, how the doctors washed their hands, how every bandage was discarded after a single use. They noticed the pharmacy cabinet, stocked with medications they'd only read about in textbooks, penicillin, sulfa drugs, plasma for transfusions. They noticed the X-ray machine in the corner, covered with a tarp but functional. They noticed everything, and slowly, begrudgingly, they began to ask questions. What is this medicine for? Why do you boil the instruments? How does the 4 work? Curtis and the others answered every question with patience. They demonstrated procedures. They explained sterilization techniques. They handed over medical manuals written in English, and the women, many of whom had studied some English before the war, began to read. Midori found herself spending hours in the infirmary, not as a patient, but as a student. She watched Curtis suture a wound and marveled at the evenness of his stitches. She watched the doctor set a broken bone and realized he was following a protocol she'd only seen in advanced orthopedic texts. She watched the nurses manage a fever and saw a system, not improvisation, but science. One afternoon, Curtis caught her staring at a diagram in a medical manual. He walked over, pointed to the illustration of a human heart, and said in his slow drawl, "You understand?" Midori nodded. He smiled, not smugly, not condescendingly, just warmly, and said, "Good, you ask, I teach." And he did. Over the following weeks, Curtis and the others became teachers. Not captors. Not enemies, teachers. The breaking point came when Yuri, the woman who had mocked them the loudest, fell ill with sepsis. Her wound, hidden and ignored out of pride, had turned gangrenous. By the time she admitted the pain, her leg was swollen, discolored, and hot to the touch. The infection was spreading. In Japan, she would have died. Maybe not immediately, but inevitably. There wasn't enough medicine. There wasn't enough time. But here, in this Texas barn, surrounded by men she had called incompetent, Yuri was saved. The surgery took 4 hours. The doctor removed the infected tissue, flushed the wound, and administered a course of antibiotics that would have cost a month's salary in Tokyo. Curtis stayed by her side through the night, checking her vitals every 30 minutes, adjusting her wiping her forehead when the fever spiked. When Yuri woke the next morning, weak and disoriented, the first face she saw was his. He was holding a cup of water. "Drink," he said gently. She did. And then, for the first time since her capture, Yuri cried. Midori watched from across the room. She watched Yuri's shoulders shake. She watched Curtis place a hand on Yuri's arm, not to restrain, but to comfort. And in that moment, Midori understood something that would reshape the rest of her life. The enemy had shown her more humanity than her own country ever had. By the time the war ended, the women of Crystal City had become something unprecedented. Students of the men who had once been their captors. They learned suturing techniques, wound care, sanitation protocols. They learned that medicine wasn't about endurance or spirit. It was about knowledge, precision, and compassion. And when they were finally repatriated to Japan in late 1945, they carried with them more than memories. They carried manuals, notebooks, and a new understanding of what healing could be. Midori returned to Nagoya and found a city in ruins. The hospital where she had trained was gone, reduced to rubble by American bombs. But she didn't despair. She opened a clinic in a converted warehouse, using techniques she had learned in Texas. She taught other nurses. She advocated for sterilization, for antibiotics, for patient dignity. She became known, quietly, as one of the women who had learned medicine from the Cowboys. Years later, a journalist asked her if she regretted her time in the camp. Midori paused, choosing her words carefully. "I regret the war," she said, "but I don't regret what I learned. They treated us like we mattered, and that changed everything." The barn in Crystal City still stands, though it's no longer an infirmary. It's a storage shed now, filled with hay bales and forgotten tools. But if you look closely, you can still see the marks on the walls where the cots once stood. You can still see the outline where the pharmacy cabinet was bolted to the floor. You can still see, faintly, the pencil marks on the doorframe where Curtis measured the height of patients who couldn't stand on their own. History remembers the bombs, the battles, the grand strategies. But it often forgets the small moments, the moments when a veterinarian from Texas held the wrist of a woman who had been taught to hate him and checked her pulse with hands that refused to see her as anything other than human. They laughed at the Cowboys until the Cowboys saved their lives. And in doing so, they saved something far more fragile, the belief that even in war, mercy is possible.